Hello, and my name is Dean Maloney, and I am a program facilitator at Rehab Group. So, what do we do at Rehab Group? So, we work with people with disabilities, and we dedicate and commit ourselves to transforming their lives and hoping that they can achieve a level of independence, educational attainment, and career progression in Rehab Group. So, basically, what this means is we focus on their goals, things they like to change in their life, dreams and wishes of what they want to be and who they want to be, and we focus on this. So this can be from getting a job to work experience, starting a new hobby, getting educational attainment, and yeah. So that's kind of the brief overview of Rehab Group's goal. So the course I studied was public health and health promotion for my final year, and for the first 3 years, I did health science and physiology, and I graduated in November 2023. So, as a program facilitator for Rehab Group, we work on facilitating group sessions. So, leading group sessions. Some of the group sessions we do at the moment is independent living, healthy eating, social media campaigns, so social media safety. And then we do sports activities as well, like football, basketball, curling. So, we develop and implement these programs. So, some of the programs that I've developed is the social media program, the independent living one, and the healthy eating one. So we design these using resources and research and create the program, and then we facilitate it ourselves, which is great. You actually get to be part of that part as well, facilitating the program. So we hope to educate our participants on things like addiction, mental health, coping mechanisms, and we use different resources for this as well. So then we provide one-to-one counselling and goal setting. So this is our key working. So we check in with each of our users, and we address whatever they're going through, whether it's personal challenges or monitoring their progress in their goals that they want to achieve and things like that. So each individual has a key working slot, and we're each given different users, and we are given that opportunity for that one-to-one time, that if they need to ask any questions or they have anything that they want to address, that this is the time and place to do it. So then there's the kind of reporting thing where we track individuals' goals, and then we assess behavioral changes. So we work closely with a lot of other supportive kind of working professionals like psychologists, social care workers, medical staff, behavioral therapists, occupational therapists, speech and language therapists. So this is kind of the networking part where we get them in, and if we do see any behavioral changes or we see that someone needs a physiotherapist, we try our best to facilitate that as well. So that's collaborating with other professionals. And then there's documenting and reporting, just like any job. We have assessments, we've reviews, and a lot of reporting and stuff to do on the individuals and their goals, and evidence based approaches, and tracking our evidence that we're doing the job that we're supposed to do. So, did you always see yourself where you are now? No, I would say not until my final year. My final year, really, I got to develop what I liked, which was the health promotion kind of side. So, I say for the first 3 years, I found myself jumping between paths, seeing if I liked this, if I didn't like this. Like, I didn't really like labs or, um, yeah, labs. No, wasn't for me. So, the health promotion side of things, getting to develop programs focused on an area of a special population and then develop something was really interesting to me. And then actually getting to present that or facilitate that was just another bonus on top of that. So yeah, not until my final year, I really found my grasp then when I did the public health and health promotion, that that's the career path I wanted to do. And it's broad and it opens a lot of doors. So looking back, what are the benefits, the route you took to where you are now? So I'd say growing my confidence, the presenting presentations, any type of group work kind of has helped a lot in terms of developing myself and my confidence, and you learned a lot of skills and competencies along the way. My volunteering for my final year was with Connect Cafe. So this, I kind of got a grasp of facilitation and how facilitation in groups can actually really impact people, and it's a really rewarding and satisfying experience. And then bring me on to my work experience. Then I did my work experience in ATU with Grace McGee, and I found this just really important in the sense of understanding how an organization works, understand how important it is to be organized, because I was really unorganized. So I say my final year project and work experience, two of them hand in hand, made me realize how important it is to be organized. You kind of get away with it in college, even though you mightn't think you do, but once you're actually in a job and you have to be organized, it's a different ball game. Which I learned anyways because I was really unorganized. So yeah, my work experience helped with that. It also helped with learning that networking is really important. With linking in with different agencies, organizations, just people in general, and keeping that relationship going as well. So some of the skills and competencies developed in the course, now I just won't go through all of these, but I'll go through a few of them. Program design, so that was learned through my health promotion kind of modules, where we developed focused on a special population or a special health kind of area and focused on making a program or a proposal based on that. Teamwork, all the group works, networking, as I said, vitally important in any kind of job, I think now, because we all collaborate with each other. We're doing our social media safety campaign now is we're doing a shared learning piece on it because there's other organizations that have had a similar issue to us with regarding social media knowledge and social media safety. So we're doing a shared learning piece on that. So we're working with the HSC and other other day services and organizations to facilitate and help out as best we can. Organizational skills, as I said, I was not the most organized. I probably can do with still a bit more learning on that, but it's important. Presentation skills build up the confidence. Communication also just builds up the confidence, and facilitation. The one thing I'd say about facilitation is anyone that does facilitation in classes, don't let that be your idea of facilitation because it's a daunting experience doing it in front of your classmates. But when you actually do it in front of a group of people that might actually get a rewarding and satisfying experience out of it, I think that's really beneficial. So don't take facilitation because it is daunting, and realistically your classmates are just waiting for their turn to go up, so they're not really even thinking about your facilitation, like what you're doing, like, and you have eyes burning on you. So facilitation is actually great and it's a really rewarding and satisfying kind of job. So piece of advice I would say, uh piece of advice, Jesus, not one for giving advice, I don't think, but if I had to give a piece of advice, I'd just say you should try and focus on what you like and make that your career. Something will pop up. I thought I was going to be jobless and still working in the petrol station that I used to work in, but no, there's always opportunities out there, and keep an eye out for opportunities. I use Active Link. It's great for getting notifications on job updates and learn your interview skills, update your CV, and you should have no problem with getting a job. With your lecturers' help, obviously, don't be afraid to link in with your lecturers as well. They're there to help, and they're actually really good at that as well. So I would say link in with them, the ones you like. So yeah, that's basically my presentation. I hope it's helped and it's somewhat beneficial to you. Yeah, so thank you.